All right, so thanks for coming. What I want to present to you guys today are some of the value-based behaviors for the physical therapist assistant. And my idea here is I really actually want to help you guys out for when you go to your clinicals. You're only a semester away from that. So over the next 10 minutes, I just want to give you a few tips that will really help you succeed in the clinic. So I think these will be a few nice things. So the first thing I'd like you to do, if you can, in one word, what does professionalism as a PTA mean to you? And you can send several words, just send them separately. So if you can, and this is just brainstorming, take a few seconds and send me a word or two. Okay, punctuality, respectful, good. Integrity, I like that, good. Efficient, empathy, that's a word we've used in a couple other courses. So you guys are actually getting to some of the core values of what it actually means to be a professional as a PTA. Thank you. The actual first core value is altruism, and I think we know what that actually means. And in our jobs, as they are, we are there to help people, right? That's what probably a lot of the reason that we go into physical therapy. But just doing that and just fulfilling our job role isn't necessarily altruism. So to illustrate that, I have a little poll here, and I just wonder if you guys can pick out for me which of the following behaviors most represents altruism. I'll read them for you. If you were to consider the socioeconomic factors that influence your patient, is it providing the best evidence-based treatment? Would it be the case that you rearrange your schedule to accommodate a client or patient? Or is it contacting your legislator about improving access to physical therapy? Which one of those most represents altruism? Okay, we've got some answers. So altruism is actually putting the needs of someone else before you. So in this case, the actual answer would be C. This would be a case where you might need to rearrange your schedule or switch your day around in a case to actually help a client that otherwise might not be able to be seen or served by your clinic. So that's actually what altruism means. Arguably, these are all great things to be doing, but the actual definition of altruism is best encompassed here with answer C. Caring and compassion, that's a big one. And I really like this picture because if you think about it, you can't think of maybe two more different individuals, right? We have people from different ethnicities, different age groups, an elderly person, maybe an older therapist, and a younger client. But doesn't this look like genuine interaction to you? That this therapist and this client are interacting almost on that next level where they're both working together to achieve a goal. So my next question for you with caring and compassion is when you interact with someone, how do you know that he or she cares? Open-ended question. I like that, eye contact. That's huge, right? Let someone know that you're connecting with them, paying attention. Body language, I see. Good. You guys have a lot of them. Empathy shows up again, right? This is the case where we need to be actively listening to our clients, making eye contact, letting them know that you care from the get-go, that they're coming to you to get better. And sometimes they don't even know why they're there. And you have to try to explain that to them, or hear in their own words why they think they're there. Continuing competence is another core value for the physical therapist assistant. And just like we're going to go into the next room here in a little bit and test your competence, right? That's how first you have to know, and we taught you about electrical stimulation. You have to know how, that's what we're going to test over there, that's competence. When you go to the clinic next semester, you have to show how. That's performance. And then when you regularly do that day after day after day, you are doing, or you are working at that highest level of competence. So it's really professional expertise goes up when you're actually doing and living out those things every day. This also includes knowing what your limitations are, what your weaknesses and strengths are. Also things like participating in journal clubs at work. That way that you're continuing competence throughout the entire clinic. Duty. Well, when we think about that, don't we, I think about this. I've never served our country, but I think individuals that do definitely have a sense of duty and a sense of pride. But we should have that too, as physical therapists and physical therapist assistants. And we need to think about, well, what do we have a duty to do? And if you think about it, we have a lot of duties. Some of the main ones, especially for you guys going into the clinic, are you have a duty to ensure patient safety and confidentiality and things like that. And once you graduate, you have a duty to help instruct other PTAs, mentor other PTAs, or even instruct and mentor other students. So those are just some things that come with the duty aspect of what our sense of duty should be as a physical therapist assistant, along with your obvious duties to your clients and patients and insurance providers. This one is a tough one, right? We don't like it when someone questions our integrity, right? They basically questioned our foundation. And C.S. Lewis said that it's doing the right thing even when no one's watching. And so that really encompasses a lot of aspects of what we do in the clinic. What are you going to do when no one's watching? Some of your responsibilities here are, again, knowing the laws that govern your practice as a physical therapist assistant. What can you do and what can't you do? It's also being honest and trustworthy with your clients. If you have a client that can't afford to come in twice a week, even though your clinic would like them to, business-wise, if they don't need to be there twice a week, will you level with them and be honest and say, you know what, we can get this done once a week? That's integrity. This is a big one. PT-PTA collaboration, right? It's not PT's the boss and PTA is subservient to that. That's really not how it works. So I want to play a little video from the APTA that really illustrates this.
So our model is one of collaboration, where we spend time leveraging our ideas and our collective thoughts on how we run our regions within a company. I think bringing the perspective of the entire profession into the room, when that leadership team comes together, bringing those perspectives together gives an idea of not only where we are today, but where we need to be. It brings another advantage to the table with respect to recruiting. If I need a PTA in a clinic, I can go to David. PTA can assist in that interview process. Also, that PTA can see that David, as a PTA, has gone from being a clinician into a management role. With that PTA, may have that opportunity themselves. From my perspective, what I've seen in many practices is a hierarchy of practice. And if you're in a position of, if you're a PTA, you're a PTA. If you're a PT, you're a PT. And the decisions are not really shared between each group as far as how do we make this a better practice. So where I see this as an advantage is it's true collaboration. And I would add too, the mentoring is not one way. It's definitely a two-way street. It's not just the PT mentoring the PTA. It works both ways. I think it goes back to that part I talked about earlier, collaboration. We really try to leverage our collective genius to get the best outcome.
What I really like about that is it's a two-way street, right? The PTA is bringing something to the table, the physical therapist is bringing something to the table, and it's not that hierarchy that they talk about. Responsibility, well, we know we have lots of responsibilities, and you will when you get to the clinic. Some highlights for you maybe will be working within your limitations. knowing when you're not going to be able to complete a task, maybe due to skill level or needing for continuing competency in that area. But the other thing here is completing patient care tasks and things like documentation on time and in a timely manner. That's a responsibility, and it'll take a little bit of practice for you, but you should be efficient there by the time you're done with your clinical. The other thing here is we need to communicate with individuals in a timely manner. Maybe with the physical therapist, maybe with whoever your CI is, with a patient, a manager, or an insurance company. And then finally, we have social responsibility. This is big picture stuff. And some of you helped and participated in Legislative Day, and we've already done some of these things. We've advocated for changes in laws along those lines. Some other things here are advocating for your patients or clients in the clinical setting. And you may need to call an insurance company. You may need to argue a little bit with them. The other thing too is we need to promote a healthy lifestyle and promote wellness within our communities. So I hope these kind of make sense to you. I hope they will help you on your clinical journey. And these are the values-based behaviors for the PTA. Thank you.